Longevity is good news. Aging is good. What we want to see is the investment in the things that make the biggest difference.
BC Seniors Advocate says that the province is falling behind in meeting the basic needs of its older residents, and it has to keep up with the booming number of British Columbia's 65-plus population. In an annual report on senior services, Dan Levitt says that despite some investments, there are still gaps in the system for older adults, particularly at long-term care facilities like this one.
When the program was introduced, the long-term care program in 1978, it was celebrated for the fact that you could enter the system through the primary care system. Now we know doctors are a challenge to find one. How many seniors are attached is a concern. And then if you are attached to primary care, how are you getting into the system? You should be able to get in the system in a planned way, waiting at home.
Levitt says home care, housing, transportation, and community services are other areas where seniors need more support. The number of seniors in BC has grown by 45% in the last decade to more than 1 million people. And by 2035, forecasts indicate that a quarter of the provincial population will be over 65 years old. In terms of important surgeries, the report shows wait lists for knee and hip replacements for seniors have increased by more than 50% in the last 5 years. With so many challenges facing older adults, Levitt says there needs to be a centralized plan.
My number one ask right now of government is the seniors plan. We want to see that whether it's housing, whether it's health care, whether it's transportation, whether it's the income supports, we want to see all those things wrapped up together so that seniors, from their point of view, they're connected and they have navigation right through the system from the moment they need their first services until the end of life, including bereavement support for their loved ones.
In Vancouver, Kier Junos, City News.